Hi, so in this video, we'd like to come back to the topic of HPV infection, CIN and cervical cancer. So we'd like to emphasize that our treatment is also a preventive treatment, and then we want patients to avoid going for cervical colonization or hysterectomy, which is the worst treatment a woman can undergo. So hysterectomy and cervical colonization are the standard treatment that a lot of hospitals globally will provide if you have been diagnosed with a HPV infection that is potentially cancerous, or CIN 1, 2, 3. Because they fear that it may develop into cervical cancer, they will recommend cervical colonization, which means surgically removing these cervical tissues. Or if it's found to be severe or too advanced, they might even recommend hysterectomy. So cervical colonization is not recommended here at Antai Hospital because it can cause cervical insufficiency, the primary cause of a late miscarriage. If you undergo cervical colonization, you may have a high risk of miscarrying in the second or third trimester during a pregnancy. And furthermore, if you do a hysterectomy, undergo a hysterectomy, it is a very damaging procedure and brings along a lot of lifelong side effects, because once you lose the uterus, you can no longer have children, you will suffer the hormonal imbalances, you may also have urinary incontinence, constipation, and it may also affect your mental state. So we do not recommend going for cervical colonization or this hysterectomy, as it is very damaging, and we believe that the proper treatment is undergoing a treatment according to the cause. Now, we here at Antai Hospital have already invented a proprietary medication known as anti-liquid medication, and this procedure does not need any surgery to be conducted to the patient. This liquid medication only needs to be applied on the area of these abnormal tissue growth, wherever these CIN, infection, or in situ carcinoma, wherever they are found, we will just apply this medication, and then these tissues will shed in 2 to 3 days, revealing healthy tissues below, and it will prevent it from developing into cervical cancer. So we hope that in this video you've learned that you should avoid cervical colonization, avoid hysterectomy, and